All right, we are live.
All right, good morning. It is January 13th, 2021, and this is the Senate Health and Welfare Committee meeting. Welcome, everyone. This morning, our agenda begins with committee discussion, and then we'll be moving into a joint meeting with House Human Services and House Healthcare. And Nellie, remind me, we are moving there, we're beginning the joint meeting at 10:15, is that right?
Correct, yes, and we will be
Okay.
at 10. We will be ending this Zoom meeting and then moving over to House Human Services live stream to continue the joint meeting there.
Okay, and so we can talk about that a little bit. I think everyone got Nellie's email about logging in mute. So um, we originally, and probably more appropriately, had this discussion set for after the joint meeting. And unfortunately, Commissioner Levine was not available until 10:15. So we have discussion before the meeting happens. But I think it might be helpful, based on what our concerns are, to talk a little bit about what we hope to gain from today's joint meeting and the things that you're looking to hear from Dr. Levine. So why don't we just open it up for that conversation first, and then as we go along, if folks have questions about any of the stuff that we talked about yesterday, we can do that. At the end of today's meeting, I'll give you somewhat of a heads up on where we're headed for the rest of the week and possibly into next week. And this is before we have our agenda planning meeting today, but we'll just get a start on that. So I guess I'll open it up for comments, questions, and what you would like to, what you're hoping to hear from Dr. Levine, because I think he's talking more generally about Department of Health planning and so on, and that, and as well as vaccines. And I know that's been a huge issue for all of our constituents as well as ourselves. So why don't we start with that and just open it up? Let's just have a conversation. If we start running over each other, then we'll raise our hands. But I think let's just, any comments?
Ginny, I'd certainly like to know how the Department of Health has fared with the money that was appropriated, how that's been used. Was it sufficient? What do they need? Certainly with, when we started out, when there was such a kerfuffle about PPE and, what are we doing about that? Are we planning ahead with some kind of reserve? That type of thing.
Yes, that's good. I think that is one of the goals today, is to look at the previous coronavirus monies that we received. And it's going to be difficult for us because I know there's some language in the stuff coming to us, the new CRF, that speaks very much to the question you're excuse me, the issues you're concerned about. So, but good. All right. So I'm the reason I'm asking for this is I'm making a list. I'm going to check it twice. And because there's going to be almost zero time for questions and discussion because so many people are on. But if we keep this list, then maybe I can be designated questioner. It's not, they aren't my questions, they're our committee questions. And maybe we can make sure that these things get answered. So that's my goal here. So.
Yeah. So okay. I would agree with, Cheryl about, do they have the resources they need? And and looking forward, what are their needs going to be? I think that'll be an ongoing conversation throughout this session as we prepare the budget for the next year. But in the budget adjustment, is there anything we should be aware of? I think all of us have heard from so many constituents with concerns about vaccination and the vaccination plan. So I'm hoping he will go over that. I'm particularly concerned about our long-term care facilities, that many of them have not gotten vaccinations yet, the staff and the residents, and yet vaccinations are being rolled out to less vulnerable populations. And similarly, vaccinations basically for anybody who is in a residential facility of any kind, whether it's, for seniors or for youth, or frankly, our correctional facilities. These are people who are living together in congregate living and are especially vulnerable because of that. And many of them have been in isolation throughout the year, on and off. So I'm really worried about not only the impact of COVID, but the mental health impact. So I'm really hoping he gets into that. And then just making sure that as we're seeing just record numbers in our state, that they have what is he seeing, sort of the lay of the land, and how do they have enough resources to deal with it, and what is their plan right now? It probably is more of the same of what they've been doing. They've been doing an excellent job, but we're obviously in a new phase here. So
Good. These are all really important questions to ask, and I think let's just hope that they all get answered satisfactorily. We can always invite Department of Health back in to get more detailed information. And on Thursday, we will have a broader discussion. I don't know if you looked at the agenda. We're going to be swamped with people on Thursday, but our goal is to get some of the information that you're concerned about on, if we can, long-term care facilities, mental health issues. If we don't get it, again, we come right back and we can ask for that information. So they're all good. Any other?
Josh?
Senator Terenzini.
Senator Lyons, I hate to do this on day 2 here, but I need to take about a 10-minute break. My wife is at the doctor's with one of our kids, and our other one has the stomach bug, and she needs my help.
There you go.
Okay, listen.
First thing first,
Be back
Josh.
in about 10 minutes.
Yeah, just keep your sound on, and you'll be able to hear everything. It'll be just delightful. No.
They don't want to hear everything.
No, you're excused, Senator.
Thank you. I'll be back in a few.
No. Okay.
We're talking about vaccines now, but what about testing? I mean, how accessible is testing now? Is it easier to do? I know before you had to have an appointment to be tested. Has that been made more accessible?
Okay, you're talking about testing, not vaccination.
Correct. Correct.
You want to know about the accessibility.
Right.
All right.
you still have to make an appointment in general. I had a test yesterday, so it
Good.
was very easy. It was a drive-through test, but you do have to make an appointment to do it.
And similarly for the vaccination, and the issue is, do we have the capacity? And the testing capacity hasn't been questioned. So the vaccine availability and distribution is a concern. So that's one of the questions that I think we should make sure we hear about, and that is the availability of the vaccine and how it's being distributed. So
yeah, it feels like deja vu, like we're going through the same thing with vaccines that we went through with testing at the beginning. And I hope we have the infrastructure to ramp up the testing faster. I mean, they could be doing vaccinations at these sites that they're doing testing.
Well,
So,
there's home
ahead.
testing available now.
Yeah.
Home testing.
Yeah.
And I don't know how effective it is or how accurate it is, but
Well, we can ask that question.
Mhm.
Which tests work the best? And some are more expensive and some are better than others. I know the PCR is probably the one people want. Or so I guess when I've talked recently with one of our larger distributors and providers for vaccines, and they have facilities ready to go, and they're just waiting for
Mhm.
vaccines. And I guess next week is a critical time for that. So let's find out though specifically.
Mhm. Another, sorry, was Ann talking? I'm sorry, Ann, did
Nope.
I talk over you? Okay.
She will be. We'll put her in the mix in a minute.
Two things. One is that related to COVID is I had a conversation yesterday with the Adjutant General about our National Guard members who are deploying and the COVID protocols and protections that the National Guard is hopefully ensuring. So I don't know if Department of Health is working with them. I would hope so, but we're about to deploy a bunch of people and to a place where there's even more. I think they're going to Florida first. So I know that there are concerns among family members about that. That may not be specifically something that the commissioner can address, but I've just heard concerns about that. And then the other thing I'd like to ask, or hopefully the commissioner, the sort of other health issues that besides COVID, but that may be exacerbated by COVID, like we've mentioned, mental health, substance use, and sort of what is he seeing beyond the direct impact of COVID, but maybe the secondary impacts in other health areas.
So we'll try to get that information from him. We may have more of that tomorrow, but that's it's certainly important for the Department of Health to be collecting that type of data. Right now, they do have a fairly good dashboard with for data collection, but that's a good point. It sets us up for tomorrow as well to have that brought up.
Yep.
That's good. Excellent. Senator Cummings, any thoughts, anything that you're particularly interested? I know from your perspective on joint fiscal, as chair of joint fiscal, do you have any insight, I think, into the funding piece, CRF?
No, we put out extra money maybe a month ago for more testing. And we know that money for vaccines would also be needed, but the way it works, the request has to come in from the administration. That request hadn't come in. There is still $4 million on the bottom line that hasn't been obligated. And there may be more out there that hasn't been taken back since the expansion went through. So at this point, the original setup was that as much as possible was going to go through the regular appropriations process. But if there's an emergency, the administration had a pot of money. I think they still have some in that they can expend. So there's a couple roads, but so far I'm not aware of any big ask for vaccinations. I may find out. Money Chairs meets Wednesdays at noon. I may find out then that there is something in the works.
Well, I do know and this may help with that discussion, but as I read through the CRF, the new CRF, there's a significant, don't ask me the amount, it's like the 40 million, 27 million, I forget which number it is.
Yeah, there's money in there.
Yeah, there is money in there. And since the vaccines are probably going to be ramped up more next week, it may be, I don't know how fast this money is coming to us, but that might be a mixed discussion, or how the 4 million can hold us over until something like that. The flexibility of that, I call it the leftovers. Okay, thank you. That is actually very helpful. I was under the impression that we had more like 10 to 30 million dollars on
There's money that there was 14 million that came back from the Department of Ed, which some of us were concerned about, depending, on the forecast for Ed. But that was, and then the ability to use that money was expanded beyond the end of the year. And people were saying, well, gee, if we'd known that, we wouldn't have rescinded what we rescinded, because if we had till February, we could use it. So I think we're still in working that out, and it's the administration that's working it out. I haven't had any updates, but then the first time I've met with the Joint Fiscal Office meeting with the money chairs will be today at noon.
okay.
So
Okay.
at this point, I don't know any more than you do, but
I bet that's not true.
well, it's complicated.
Yes, it is.
Isn't that our motto?
Yes. It's more complicated than that. Es más
That's right.
complicado que esto. Yes. I forgot. It's sitting right there on the wall. We've got it.
There it is, in English and Spanish.
You got it. And that's something we all need to know. Everybody on this committee, anybody asks us a question and we try to answer it, we always have to say it's always more complicated than that, because it really
I
is.
lost my sign. We had Carpe something, which was seize the Christmas tree.
Oh,
Because
Somebody
I am
else.
known for my love of decorating Christmas trees at the end of the year.
I know you are. Well, we have some things maybe we'll get to you.
What does
All
that
right.
mean, Anne? What do you
The
mean?
Christmas tree is a bill you can hang things on.
Oh, okay.
So miscellaneous tax, because it is such a broad issue, is the proverbial Christmas tree. And anything else that hasn't found a home frequently ends up on miscellaneous tax.
Got it. Okay.
Josh, you didn't hear that.
It's well known.
Nothing.
I-
Didn't hear anything.
I'm kidding. So
They
Senator
frequently
Terrangini-
don't send us many tax bills if they don't want us playing with them.
That's true.
So you
Senator
do seize the
Terrangini.
Christmas tree.
Any thoughts? I hope.
Well,
Listen, and I know you're distracted, so don't worry.
There's nothing like a stomach virus to
Nothing like
distract a
kids.
parent.
I have my wife at the doctor's with two of them, and then one's here, and so a little chaos, but it's okay now. And I'm sorry I missed the conversation, because I would have liked to have heard your points of view. And Dr. Levine's joining us this morning, Senator Lyons.
Yes,
Yep.
when we go in to meet with House Healthcare and Human Services committees, it's
Yes.
going to be a huge group, but he will be there, and he'll be giving a report generally on Department of Health during the past COVID experiences,
Yeah.
and maybe a little bit about plans going forward.
I'm interested to hear more about the vaccine in general,
Yeah.
because from a little bit of experience now, first of all, I'm a big supporter of vaccinations, and I think it's what's going to help us get out of this mess, this vaccine. But I have two relatives who are in the medical field who have both received their second shots of the Pfizer now, and they both have been fairly sick for 2 or 3 days with side effects. And so I'm wondering if the Moderna shot being maybe 1 dose versus the 2, if that's a big difference, or if the side effects are scaring people away from getting the shot because you feel pretty lousy for a couple days after. So I think it's a concern because we don't want people to be discouraged about getting it. But, these two relatives of mine are feeling pretty crummy.
This is very helpful.
I have relatives who've had it and have had absolutely no effect. My
Really?
86-year-old sister,
Yeah.
had
Wow.
hers and has had no trouble from it. Her
Huh.
arm isn't even sore, which kind of surprised me.
That's
Well,
interesting.
Yeah, no, but the question you're asking is a really very legitimate because, and I think particularly the older population where we see a higher incidence of mortality from COVID, I think those folks are particularly concerned about how the vaccine will affect them.
Right.
So if we don't get the specific information that you're asking for, and just knowing how many people are going to be asking questions, I'll try to get that question in. If we don't get the answer, we will have the Department of Health back in so we can dive down a little deeper.
Excellent.
You're asking specific questions about vaccine type and which types we're getting, and then the side effects. So that's not something that might just pop up today, but we'll
Right. Sure.
keep our fingers crossed. I have no idea what the complete testimony will be, so we'll see how it goes.
Well, he,
Anything-
Dr. Levine did answer 1 or 2 of my questions yesterday, and coincidentally, Senator Hooker and I got to spend some time with him yesterday and educate. Oh, and Senator Lyons, geez, most of our committee of education's here, isn't it?
I was there.
Yep.
I miss education.
Oh, well,
We'll tap
come
you.
along.
Nobody could
I-
miss it as much as I do when they threw candy. It was a frat house. And
Oh
me.
no, that does not sound fun.
It was, I had a picture of my 6 grandsons all doing the traditional, we're going to take your picture. So they all made the worst possible face and put it on the bulletin board and said, chair training.
Wow.
I
But
did.
we got a tripartisan unanimous vote out of there on Act 46. So I'm not complaining, but it was an adventure in chairing.
That is interesting. I forgot about that. About unanimous
Helen
vote.
really got appointed. Remember, Helen got appointed for like the last 2 weeks of the session
Yes.
because Dustin Degree left to do another job for the governor. I was so glad to see Helen show up in there.
Well, she's a good colleague and friend in our district.
She
so,
was. Calm
yes.
things down
Well,
a
it-
little bit.
Yes, very definitely. She knew where she was coming from.
Senator Zuckerman used to wake Senator Doyle up by saying, Bill, would you like some candy? And kind of bumping him with the can of candy.
So I want to go back
was
to
an
the
event.
comments on Education Committee yesterday. And can you hear the jets going over me?
Yes.
Yes.
Because I can't hear anything when that happens. And I don't know if you can hear me when I'm talking.
Yeah, no, it's just a background noise.
Oh, wonderful.
Yeah, it's
So
not loud.
it's
for us.
more of it's very intrusive noise. There's one more coming.
How
So
frequently
I
does
can't
it
talk on the
happen,
phone
Jenny?
when this happens.
This is like
even
the
with my-
daily train. You know the whole house is going to vibrate.
Well, it knocked the clock off my mantelpiece the other day, so I wasn't.
Wow.
Yeah, no, it was.
And how frequently does it happen?
Those-
once or twice or 3 times a week. It depends on what their training schedule is. Yeah. And, we live with it. So, going back to the Committee on Education, yesterday, Dr. Levine did come in and he provided an update on how the vaccine is being distributed and who's getting it first and why. That for me is the most critical piece to ask, because once we understand the rationale the Department of Health is using, and it's very much, he can also speak to the CDC process. I think then once you hear that, you fully understand how beneficial the Department of Health recommendations are. So I just will, if we don't get that information today, we will very definitely have that report come into committee. And I've asked for some separate information. I sent a note out to Dr. Levine to get some separate information on that, because I know how really important it is to each one of us and to our constituents. Go ahead, Ann.
Yeah, no, I was going to say last spring, there was a whole lot of activity around finding alternative placements. I remember Goddard College was going to be an alternative placement for youth that were in group homes that might be exposed, or, a quarantining place. There was all kinds of inmates were going to St. Johnsbury, and the community was all upset. And I know the Barry Auditorium, when it wasn't being used for the legislature, was going to be an overflow hospital. Just all of that seems to have kind of gone away or become, and I think it may be because we've learned more about the virus and how it spread, which we didn't know last April. But just kind of as we're looking at 300 a day possibility, which is kind of mind-boggling.
Well, the issue, I think, for us is how well the Department of Health has educated the public, and Vermonters have responded.
Yeah.
So the whole social distancing, mask wearing, staying out of closed spaces together, all of those things. And as you said, we've learned more about how the virus spreads. So not being in a room for 10 minutes with a group, those kinds of things are very important. The other issue that you brought up with the expanded offsite hospital places. Okay. Those hospital places in my district are now closed down, but the National Guard is ready to reassemble when we need them. Hopefully we won't need them, but I have read a number, and I continue, because I taught immunology and did some immunology research. And when you read the basic journal articles about this awful virus, it's a scary one, but it's also something that if we do all the things that our Department of Health shares with us, we can mitigate and get to a good place with herd immunity.
Well, Ginny, I think that's true, except for the fact that I think people are getting really tired of a lot of the protocols and need constant reminding. And basically, we are at a point where there's community spread in a lot of parts of our state. So it becomes more difficult here in Addison County, we'd been doing so well for so long. And then over the holidays, that all kind of fell apart. And now we are experiencing what the rest of the state has experienced, unfortunately. And so I think you're right. The Department of Health has done a great job of trying to get people and those of us who've been also spreading the word to get people to follow protocols and everything. But I think there's a lot of protocol fatigue out there. And here in my district, and I'm sure it's true in other places, schools are closing because they don't have enough staff. And they're going remote. Even, one elementary school or part of our middle school right now is remote. Things like that, because there aren't enough staff. So many people are in quarantine. It's gotten to a new level, and maybe we don't need those huge sites anymore. But there's a lot of concern and
I,
it's a new
you're,
level in our communities.
of course, I wasn't speaking to some of the social consequences that we're seeing, and that's where some of the mental health issues are popping up. But the staffing issue at my meeting last night with a local couple school districts, that again, was brought up. So, yes,
think
all
this-
of these things are a compound, a fracture to a very difficult,
Yeah.
a very, very difficult, almost a year now.
10 months today that we left the State House.
Yes. I mean, look at us.
And I think this just reinforces that whole phrase, it's complicated, because it is. And one of the things that I'd like to have Dr. Levine address is, I've heard from people who need to have medical care, but they're afraid to go to the hospitals now because there has been an increase in COVID cases. Even here in Rutland, someone I know was supposed to go for an MRI today and not going because there are several cases, at the hospital, and they're afraid.
Yeah,
What
that's sad.
what precautions and what assurance can we give people about having their needs met other than COVID, in this time of a spike?
So that's a really good question. We know that there was a diversion of elective services for a long time, and now people are being encouraged to go back and get care, but we've also seen this increase. So seems like a catch-22 for folks. So maybe we can get that information from Dr. Levine. If we can't, we'll get it elsewhere. It's good.
I think Senator Lyons, I think the real unsung heroes of all this are the environmental services and custodial staffs of these hospitals, because they are, you don't hear about, you hear about outbreaks in places. We don't hear about outbreaks in hospitals generally. And I think it has to do with the 24/7 care that these folks put into keeping these facilities as clean and sanitary and sterile as possible.
You're right. They are an important part of our front line. No question about it.
I'm glad we were able to give them hazard pay finally.
Yes.
Yeah, well deserved.
Yeah, absolutely. Anything else that, we've just made a huge list. I do have something else that we haven't talked about. If you want to keep going on vaccines or safety issues, safety protocol, anything there? I guess this one doesn't exactly fit with today, but let's keep our ears open. We always do. I mentioned yesterday, seems like a long time ago. Feels like we've been together for years. I mentioned yesterday a little bill that our committee had started drafting last session on long-term planning, health emergency planning for the state. And I have that bill. I actually asked some of the other chairs of committees to sign on to the bill. What it does is it looks at everything that we've done in the state for this pandemic, and it asks to put in place some upfront planning and protocols that might offset the next public health emergency. So it would go into the state plan. So the hazard mitigation plan or the emergency planning that we have in the state. That I haven't heard back from any of the chairs that they would like to sign on to the bill. So I'm keeping my options open on this. And I think what I might do is to have Katie McClinn bring that bill into our committee, and we could offer it as a committee bill if you are so inclined. So it's something that we could look at together. The articles that I've been reading about the pandemic, everybody is ultimately very concerned about the immediate response. And as well, we should be, because this is such a unique situation. But some of the articles I've been reading about sort of reinforce the thinking that there wasn't any upfront thought or possible planning for such an event. And we've seen it with, obviously, we've seen the Ebola outbreak, and we've had some plans in place to mitigate that. We've seen the SARS outbreak that we stopped cold several years ago. This one just really got out of hand, and it has hit our state very hard. So my thinking is we can, as a committee, put together this bill if you want to. The draft copy of the bill is on last year's committee page. It's under Katie McClinn's name. And I will, I'm going to circle back to the chairs of other committees and see if they have an interest in introducing the bill, because I think it should be sort of touched by each committee. You can't plan without economic development or education or transportation or anybody else. But if there's not an interest, why don't we just, what do you think? Should we pick that up? Could we do that? Anne, you know this.
Yeah, I remember it. I may be my half inch away from the microphone here. As I remember, we have all kinds of, we have an emergency management division. But it's all based on a physical emergency. It's based on getting poles and wires back up and getting food into isolated communities and
medicine there, building.
Yeah, but
bridges,
not, we at least need to do an assessment of where the holes were and work through that. Would also, I think, miss Senator Westman from last year, but we were in Taiwan in November.
Yes.
And Taiwan did get hit by SARS. And Taiwan, along with South Korea, has done the best job of really containing this virus. They had their first community spread case in 9 months. A couple weeks ago, I saw somewhere on the news.
Yep.
And I'm pretty sure they'd be interested in talking to us about how they plan. I know there were check-in stations. I know that I'd say 40% of the people on the street when we were there just before there was anything were wearing masks. It was just part of the standard, or just what people did. It was the norm. So it would be interesting to, and I'm quite sure that people from the consulate in Boston would be interested in talking with us, because I know they're interested in maintaining that relationship with states.
All right, let me ask you this question. This is an excellent idea, and obviously those two countries have done an outstanding job. There's no question about it. I don't want to pile on to your work. Why don't we'll work on this, and I maybe contact information. I do have that as well, but we can have you
I've
help
just
us.
got the one person that
Okay,
has contact. They brought, was it 3,000 masks they donated to Vermont early on?
yes, yeah, something
Um,
like that.
Yeah. I mean,
Okay.
they obviously want to maintain a relationship with the United States since China is 20 miles away and claims them. And they don't want to be claimed. So there is something going on here, but
We'll ask them for their help. That's it. We're not getting into State Department issues, but we are
No.
getting into public health needs.
yes,
Okay,
and
so
they have done well with public health.
So we
And we
will.
did copy their single payer healthcare system.
Yeah, we can do that
When we
too.
were doing it, it was Taiwan that was the
That's right.
basis.
That's right. So what I'm hearing you say before I move on to the other three people who have their hands up, I'm hearing you say that this might be a good committee bill for us. I like that. All right, I'm getting sold on that one. I was ambivalent, but I'm good. Ruth.
Yeah, I think it would be a good committee bill. I remember this bill from last year, and you'll probably recall that I talked with you about some equity issues and sort of embedding them in the bill, making sure that we were taking care of and looking at racial equity and ensuring that the plan involved migrant farm workers, et cetera. So I think it would be a good committee bill. And the one thing I would caution is, this kind of thing is that no matter how well Vermont has done, and we have done extremely well compared to other places in the country, so much of this is a federal issue, and one of the with a virus, it doesn't have borders, and it's not as contained as a hurricane or something like that. So I think we absolutely as a state need to do this. And one of the reasons our country didn't do so well is because we hadn't done enough public health planning and preparation. And we need to also maybe see if there's any way we can work regionally with this kind of thing too.
Well, let's start with the state
Yeah.
because we have a lot of lessons that we've learned and we can plug those in. We aren't going to be doing the whole plan. There's no way, but we will make sure that we cover the bases and who is engaged in developing the plan. So that's really what the bill is about. It reads pretty like, oh, it is only a frame. So, and we'll have to fill in the gaps where we see them. Cheryl, Senator Hooker, I'm going to apologize to you folks. It is important to use Senator in the committee, and I will do that.
Well,
Senator
Senator
Hooker.
Lyons, thank you. And you've already said what I was going to say. This addresses lessons learned. And I think it is imperative that it be part of the plan. It sounds as if, the emergency plan now is kind of reactive, but this has to be proactive as far as what we do to keep something out that, we really don't have a lot of control over, but if there's a way that we can slow it down or affect its effect on the state, then it should be as part of the plan. So thank you.
Terrific. And then Senator Terenzini and then Senator Cummings.
Thank you, Senator Lyons. This bill that you are referring to, is this something that we could have Katie email to all of us so I could look at it?
Yeah, we'll put it on the table. I'll get it on the agenda and I'll make sure you have it. It isn't a long involved bill, but yes, absolutely. And just to let you know that last year we had Suzanne Young from the governor's office in to speak about it, as well as Mike Sherling of Public Safety. Last year they were supportive, but overworked and overwhelmed. and couldn't think about doing anything like this at the time. So we put it off, and I
And-
will get you a copy of that. Don't worry, you'll see
Well, I
it.
appreciate it. And correct me if I'm wrong, but basically the premise of the bill is future funding or putting aside for a rainy day for another
No,
pandemic or
no.
disaster.
No, no, no. It is identifying those policies and practices that each agency, department would have in place and could pull off the shelf, and to immediately work with to ensure that any future public health emergency is handled adequately. So it's
Understood.
like, yeah, so it's like having the pontoon bridge ready to go. So, and then the snowmobile that can carry the prescription medicine to someone. So there are a lot of little moving parts.
So like a lot like an emergency management plan that you'd
Yes,
see.
sir.
A municipality have.
Yes, it is. And what the other thing that I've asked Ledge Council to bring to us and is to help us understand the flow of authority within an emergency.
Mhm.
What's federal, and we know that at the local level, who takes over when. As chair of my select board, I was very careful about understanding when the fire chief is the person and when the health person is in charge. So each of those, how the power flows, how the authority flows, how the responsibility flows, is going to be important for us to understand. Because and I see Ann, you're shaking your head. You got it.
Oh, yeah. Having been the mayor when Montpelier was underwater, and having groused every year about budgeting $2,000 to send people to emergency management training school in Maryland, I was the best $2,000 we ever spent,
There you go.
because when it hit, I've never seen so much gold braid in one building in my life, but everyone knew what their job was. They knew what they were responsible for, and they did it. And it went like clockwork. And FEMA said we were the poster child. And the role of civil government is to figure out how to pay for it when it's all over. Period.
That's right. How to go after the federal dollars.
Yeah, I mean, I found my role, which was to stand out there and be vented upon,
Yeah.
so that people who were seeing their entire life literally washed down the river. That's what I did. I was available for people to yell at me so that the folks in the back room could work. It is my great skill to be vented upon.
Aren't we all? Aren't we all?
Yeah, parenthood helps.
And it goes on forever. So let me see just a straw poll of hands. How many of you think that this might be a committee bill that we could put forward? Put your hand up if you agree with that. Oh, good. All right. Now, as I said, I did float this past the chairs, but I have not heard back from a single one. And I think it makes more sense for us just to be the point of responsibility and get it going. And then other committees can chime in as they so desire. Oh, this is exciting. This is really exciting to me. I think this is very important. And I like Senator Cummings' idea of beginning with some testimony from those areas, countries that have been so successful. So Senator Cummings, can you send your contact person to Nellie and to me, please?
Well, let me see if I can find her last email when she wanted to get introduced to Becca, but I will forward that.
Okay, good. And then I will put this topic on our agenda we have some other things that might get in the way, but we'll put it on the agenda pretty quickly so that you all can see the bill and begin to think about it. So I might do that as early as Friday, as we have some space on Friday. Okay? I can see that this is an awesome group. This is so much fun to work with you all. Thank you. Thank for your good thinking. All right. So we have 10 minutes before 10 and we're meeting again at 10:15 and we should sign on a little bit early. So I'm going to say, unless you have something else you want to bring up, we can just stop here and run around the block and then be back.
Do the laundry.
It'll
Take
take me
care.
a few minutes.
Take
My
care,
iPad
kids.
is almost dead, even though it's plugged in. So
Uh-oh.
I gotta go work on iPad charging.
Okay.
And I'll get that
10:15 with
as
the
soon as
commission.
I'm charged. I'll get that to you.
I'm sorry.
Senator,
Go ahead.
I was just gonna say, so at 10:15, and that was a different link that was sent out by Nellie to us, correct?
Yes, that's accurate. And
Okay.
Oh, let me find it then. Okay.
sign in a few minutes early.
email.
That's all.
Okay,
Yeah. And
Thank
thank you.
you.
Ruth, did you have something else? No.
No,
Okay.
that was it.
Hasta luego. Take care.
Bye.